Hi everyone, thanks for joining and welcome to Workshop 1, Health Systems in a Warming World, From Insights to Actions. My name is Camilla. I'm the Senior Sustainable Healthcare Manager for the Asia Pacific region at Bupa, and I'll be guiding you through the events of today. I want to start by acknowledging the Gadigal people of the Eora Nation, who are the traditional custodians of the land I join you from today, and pay my respect to elders past and present, and to all Aboriginal and Torres Strait Islander people joining us today. I acknowledge that Aboriginal and Torres Strait Islander sovereignty was never ceded, and that this always was and always will be Aboriginal land. Our first session today will be a panel discussion. We'll have two halves, so a panel discussion and Q&A with three speakers who I'll introduce momentarily. And we'll then jump into an interactive workshop where we'll look at two different scenarios, their barriers and enablers, and work together on a potential solution for change. During the panel we're about to engage, I invite you to ask questions to the panel as they speak, and you can do so in the Q&A tool in the panel bar just below the main screen, and we'll address some of them in the Q&A afterwards. Should we not get to your question, don't fret. I'll be in the sponsors lobby following this session, so you can join me there and we can continue the discussion. So without further ado, let me introduce our panel speakers. Two of the speakers you'll remember were introduced yesterday at the conference opening, so welcome back Roger Sharp, Chief Sustainability and Corporate Affairs Officer at Bupa Asia Pacific, and Michelle Isles, CEO of the Climate and Health Alliance. Our third speaker for today is Dr. Tony MacDermott, Bupa's Clinical Director for Health Services. Tony is a medical practitioner with a background in public health and has more than 20 years' experience in senior clinical leadership roles in government, non-government and private sector organisations, both within Australia and offshore. Tony is passionate about enhancing models of care to more efficiently use human and capital resources to improve patient outcomes and practitioner experience. And in a previous life, Tony was a dentist. So welcome to you all. I think I saw a few waves there. So let's get started. As the climate crisis intensifies, its repercussions on human health and health systems are becoming increasingly evident. And meanwhile, the healthcare sector contributes a significant amount of global carbon emissions, necessitating an exploration of the dual relationship between health systems and climate change. So Roger, I wanted to kick things off with you. You're well aware of how climate change is exacerbating health risks and that our healthcare systems need to be made more resilient to climate change. Can you talk us through the health impacts that Bupa is seeing globally and what's being done to make healthcare more climate resilient and environmentally sustainable?
Sure, thanks, Camilla, and hi everyone. It's great to be back again for this session. There's obviously some very big questions you've asked there. One of the opportunities I think we have as Bupa is because we look after more than 50 million people globally, and because we have operations in every major part of the world, we're starting to see and have been seeing for some time this developing body of evidence which makes it crystal clear that the health of our planet is having a direct impact on the health of our people. And as briefly mentioned yesterday, we can't avoid the fact that the healthcare system and healthcare sector has been playing a part in elements of that historically, not only through carbon emissions, where, as you referenced, Camilla, we as a sector, healthcare sector globally would be the fifth largest emitter if it was a country, so up there right in the top 4 or 5 emitters as a sector. And we can't turn a blind eye to the fact that the healthcare sector and the work that we are doing, primarily designed to prevent and protect human health, is also having some impacts through carbon, through waste, etc., which is meaning that effectively we are actually contributing to an environment which is making people sicker. So there's some core fundamentals for us as a company and for most of us working in the healthcare sector as to how we ensure we can make the commitment and do more to address some of the environmental degradation that's taking place, take more direct action on climate change, and ensure that healthcare systems are increasingly climate resilient and targeting and taking direct action on on carbon, on waste, etc. I think the other point I would like to make at the outset, and I'm sure we can pick this up in questions as well, is that when you look at the impacts on human health from climate change, for example, it's not simply a physical impact. It's not simply the contributing factors of heat, of air pollution. There's a huge mental health factor as well. And, whether it's climate and eco-anxiety, whether it is the knock-on stresses, which have huge mental health dimensions, I think it's really, really important that as we go through the discussion about what the health sector and healthcare needs to do to be more climate resilient, that we don't lose sight of the mental health as well as the physical health impacts. I also think there's a really, really important nexus in the question you've asked about health and the environment and health and climate change, because we see through some of the data on eco-anxiety, particularly for younger generations, there's a sense of disempowerment, the sense of detachment about what an individual can do themselves to take action and to take a stance to deal with the global and the scaled challenges of something like climate change. And this is where I think the personal connection of personal health to climate change is so important. It creates a direct individual locus. There is nothing more personalized than your health. And if you can concentrate on healthy activities for you as an individual and within your community, then you start to be able to find a way to respond to some of these what appear to be global insurmountable problems such as climate change. So healthy people, healthy planet, the role of an individual in looking after their personal health, which is why programs like our Healthy Cities program is so important, I think, because it gets improvements to personal health as well as contributing to wider community benefit and action on environmental health.
Yeah, thanks, Roger. I think, touching on the personal responsibility that a lot of people feel for climate change and their health can definitely exacerbate mental health issues. And I know that there's plenty of research on that. And I want to turning now to Tony, and I think that that's a good segue just from the personal to the kind of larger scale organisational or even federal challenges. Tony, I wanted to ask you about Australia in particular and just those unique challenges that Australia faces in sustainable healthcare systems. Can you share with us some of those unique aspects that sit kind of outside the personal and sit more within the systems level and how Bupa are approaching them?
Sure. Thanks, Camilla. I guess every country is facing the same problems regarding healthcare and sustainability, particularly the more developed countries, given that we are the resource consumers. And Australia has a couple of additional challenges on top of that. The most obvious one is the fact that we have such a small population, relatively speaking, strewn over a very large geographic area, which means that we have far higher distances for people to travel, and that contributes to emissions disproportionately to other countries. We've been trying to address that. It's not just a emissions issue, it's an equity issue as well, through digital care. We have a digital platform called Bluer, which is a gateway to a digital ecosystem which we're developing so that we can maximise the amount of care that we can deliver where clinically appropriate to people remotely and provide them not only with access but also reducing some of those type 3 emissions. We aim to build that network as widely as possible. We started with medical consultations, virtual consultations in regional Australia to specifically target that area. We've since broadened it to all Australians. So we'll continue to develop that virtual ecosystem to deliver those access and emissions benefits. The other problem Australia has, and it's not unique to us, but I think we sort of probably worse than most countries, is the fragmented nature of our healthcare funding and administration. We've got, various funding bodies involved. We've got state hospitals, state governments with hospitals. We've got federal government with primary care. We've got insurers and patients in private hospitals and combinations thereof in various outpatient models. And when you've got fragmented funding and the service design follows the money trail, which is often how it goes, then you ended up with a fragmented model of care, and that means that care is delivered in bits, and the more bits there are, the more resource intensive it is, both in terms of human and capital and environmental resources. So we're trying to address that through another ecosystem that we call connected care. We're trying to integrate our health services so that the patient journey is more seamless and more integrated, and that we're delivering an episode of care that's more connected than disjointed, and saving on time and convenience and emissions through that process. We've got a long way to go with both of these initiatives. They're both connected, but we will continue to build this out and offer this to at least our many millions of Australian members, and hopefully the entire Australian population in due course. We're also doing other things like reducing single-use instrument usage, consumables. Most people won't know that Bupa is the largest operator of dental clinics in the country. Particularly our dental business uses quite a lot of disposables, and we are slowly phasing them out. Or our electricity supplied for our services are 100% renewable. We're also making some sustainable investment decisions, which Roger, I'm sure, will be happy to talk about, and as well as funding startups who are active in the sustainable space, particularly sustainable healthcare, through an initiative we call Eco Disruptive. So we're doing a bunch of things. We've got a way to go to bring our patients and customers and staff along on this journey, but we're definitely committed, and large organisations have this social licence responsibility to take care of the environment. So we're definitely committed for the long run. And we're also partnering with other organisations more holistically, and Michelle and Roger, I'm sure, will be happy to talk about that more. Thanks.
Thanks, Tony. I think they will. And we had a few comments in the chat yesterday, just in the opening session, around the unique position that health insurers and providers are in to create that change. And I think it sounds like it takes really a village to create any meaningful change. And Michelle, I know that you know all about that as CAHA's CEO. You've been here since March this year, and your organisation, Climate and Health Alliance, their conference, brings together member organisations to act as advocates for national and global action through advocacy, policy and leadership. There's around 100 members across private, public and government organisations. Michelle, can you talk us through the evolution of how CAHA has influenced change with, for and through its members?
Thank you, Camilla, and lovely to be with you here today, and lovely that Bupa has also joined CAHA as a member. We're very excited about that. I'm actually joining you today from another member, a community health service in Victoria, which serves a lot of Victoria. And it's been interesting hearing about their journey today. A few years ago, they were looking at, small steps around how they can get people to connect to the issues of energy and impact, to, today they are one of our real zero champions in the Healthcare Without Harms Global Green and Healthy Hospitals program. They've got electric buses, which they use to move their community and patients around, some really extraordinary efforts. So CAHA was founded by 4 members 14 years ago. And even until about 4 years ago, we had about 45 members representing lots of different parts of the health sector. And I think what we've seen is that many health leaders saw there was a challenge, saw there was a clear connection between health and environment. But our clinicians and health leaders have so much to focus on. We need the depth of their expertise, and we haven't necessarily had that capacity to be able to step up and shape change and respond to some of these sustainability and climate challenges. And that's where CAHA came in, by providing that alliance where organisations could come together and we could provide some of the shared resources, advocate together for change, and also share initiatives so that each organisation, each health service didn't need to start from the start. They could look to their peers, look to examples. We've seen that grow over many years, but I think in particular in recent years, we've seen, because of the climate impacts that we're now facing, we're seeing necessary acceleration of that effort. We're seeing some resources starting to flow into organisations to be able to have dedicated people working on policy, people working on actions. And so we're seeing more of our members step out and advocate and progress, and many of the participants of the Global Green and Healthy Hospital program, as I mentioned here with your community health, really deepen their efforts. I think, again, because of those climate impacts, we're seeing a shift from looking at the environmental impacts and the pillars to how do we look at the type of care that we're delivering. And of course, we know that the best medicine is preventative health, so that we, actually look to protect communities, safeguard them from some of the health hazards that we're seeing, so they don't have to use our services as regularly. But we also are looking at that continuity of care. And so what we're seeing and the support that we're providing is now evolving to looking at those models of care, looking at the value of care, looking at governance around health, which is really critical to be able to make some of the big decisions and some of the bolder decisions that we're needing now in the face of climate change. And also we're seeing a lot of strategies and plans and actions around climate resilience. So having to respond to looking at efficiencies in the way we deliver health to drive down impact and decarbonise, but also to build resilience to climate impacts. And that's both in, from infrastructure point of view, but also looking at, of course, the people, the relationships, the training, the education. So these are some of the themes that we're seeing emerge. But I mentioned yesterday, the CAHA Alliance has grown significantly and across Australia and New Zealand, and indeed in the Pacific. And I think we have created some really significant change in that together we've been able to get governments to listen and to make some of the policy announcements, to put in place the frameworks, look at our, both the strategies but also the standards that are in place to start to embed sustainability and climate. Collective being something unique. And we now have national frameworks, we now have national strategies that are then being delivered and looked at from a local context.
It's a big job managing the organisation. Lots of members, lots of great work going on. And I know you touched just briefly on how CAHA is expanding across Australia, New Zealand, across the Pacific. It is, again, another perfect segue into my last question, which is for Roger. Our partnership in Asia Pacific is with the Climate and Health Alliance, but we've also got a partnership with CAHA's parent organisation, Healthcare Without Harm. So, Roger, could you just, before we jump into the Q&A, just share with us some of the importance of global communities and why partnerships are essential to the sustainable health systems transition? Michelle's just touched on several reasons, but I know that we're doing some really great work both with Healthcare Without Harm more globally and with some others.
Yeah, thanks, Camilla. Look, the short answer is just common sense, to be frank. The nature of the problems that we are facing into and the scale of the change that we need to collectively deliver simply means that any one party, even as company as big and as far-reaching as Bupa, cannot do it all on its own. So there's a pragmatism to the need for partnerships, because the solutions and the scaled impact that we need to make to ensure that healthcare is able to be delivered in a climate-friendly, environmentally friendly way, and that we're able to take actions as a sector to address some of the challenges that our planet is facing into, make it just a no-brainer from my point of view that we need to work with like-minded organisations and other sector bodies, public and private, to ensure that the action and the work that needs to be taken place does indeed occur. I think there's also, I think, a personal element to this for many of us, which is one of the reasons we like this area of work. One of the reasons why many of us are so passionate about driving change and trying to play our part is because fundamentally this is a collaborative pursuit. It is something where you get to work and learn from and be inspired by other members of the healthcare system and the wider kind of organisational environment more generally. So I see the partnership between Bupa and Healthcare Without Harm globally and obviously at an Asia Pacific level with CAHA as one example of the common sense strategic relationships which are mutually beneficial. This is not just simply about a large organisation like Bupa providing, sponsorship for a conference. It's about learning from CAHA. It's about finding connections through their relationships into other in the healthcare system so that we can play our part, learn from, sometimes share information that will be helpful to others. So there's a real win-win through this type of symbiotic relationship. And I think, frankly, we need to see more of it as we move forward. It's great to hear from Michelle about the growth and the dynamism that's coming to CAHA with a number of organisations coming on board. I think many of us would feel that we almost had a lost decade in Australia where action on climate change stalled. I was pleased to see during that time that perhaps with a lack of government leadership, we did see some more progressive business and third sector organisations fighting the good fight to keep this agenda moving forward, and we've got to continue to do that as we move into 2025 and beyond. I think a couple of other points I'd just like to briefly make. I mean, I know it's come up as part of the conversations yesterday, and also will no doubt flow through this week. But we also need to be prepared to embrace change as a sector, because the most environmentally climate friendly healthcare is actually the ones which doesn't need to be done in the current setting. So there are huge opportunities through digital healthcare which we need to embrace. It's difficult to say that the COVID pandemic achieved any real good, but one of the areas where it was helpful was that it enabled governments to release the settings so that more could be done digitally. And certainly we see across the Bupa landscape, including in our market in Spain, that we are now equipping customers with huge amounts of digital opportunities. We're also doing it, as Tony mentioned, with Blua here in Australia and Asia Pacific. But as part of your offer through Bupa in Sanitas, our Spanish business, you are given options for a wide range of digital consultations and indeed a carbon calculator, which provides a saving to you of the indication of how much carbon you've saved by not having to physically travel to perhaps the hospital or the site you would otherwise have gone to physically. And I do think there's a real question we all need to face into, and it's absolutely all parts of the system need to face into this, is about how do we need to change the way we're currently set up, the way we're currently organised, the way we're currently operating to address some of the challenges which climate change and climate action demand. And one thing is for sure, doing things the way we've historically done them is not going to be sufficient. So we've all got to be prepared to embrace some change, to lean into some uncertainty and some ambiguity, and to challenge some of our existing business models and ways of working. That's what I think climate action demands, and I think that's what we as a business are certainly trying to do. The final point I just wanted to mention is obviously partnerships. At Bupa, we are really trying to step up our engagement, not just with CAHA, but also, as I mentioned, with Healthcare Without Harm globally, but also with Monash and their transition to sustainable health systems consortium. We've been delighted to come on board as one of the major private sector partners in that conversation. There's a lot of public sector hospitals and health organisations, community organisations as well, but I do think we need to see more of the private sector coming on board. This is a collective issue that we need to face into, where public-private boundaries should in some ways fall away, and we should be focused on addressing the need which is in front of us, not just the way we're currently structured. So I might stop there. Hopefully that's been provocative a little bit, and we'll drive a few questions. But
yes.
Look, just huge thanks to Michelle, the CAHA team, and many of the people on this call that we've got connections with through the Monash relationship as well.
Fantastic. Thanks, Roger. You actually answered one of the questions that we're going to be asked, which was around the bluer telehealth services and the carbon calculator that is part of that. So I'll ask another question. Michelle, going back to the Climate and Health Alliance for a moment and just the work that's being done, I think for anyone who's on the call who's not a member of CAHA, if they're thinking about joining or, are in the process of joining, what kinds of work or things can they expect to be doing, and how can they expect to get involved?
Thanks, Camilla. As I mentioned, and you've talked about as well, we have a real diversity of members, so across 70 health professions, from our major colleges to small Indigenous organisations. So we are very mindful of that diversity, and that is indeed our strength, public-private. So we provide a service that is for all members, but then also tailor. So, for example, I came and did a presentation here today as part of a climate action forum where various partners came across this community to be able to learn and look at their climate action journey. We provide amazing resources on a weekly basis. Shout out to our Policy and Communications Coordinator, Layla Humphreys, who provides a wrap-up of policy, of career opportunities, of member wins every week, which I think is a really great resource. We work together with our members around major policy opportunities. So we both provide thought leadership, we translate research and look for those gaps and opportunities, but we also respond now that we're seeing our state, territory, regional and federal governments more proactively pursuing this climate and health agenda. We make sure that we have a health in all policies approach. So we're looking and we track now the National Health and Climate Strategy for Australia, but we also get our members together to comment on the National Climate Adaptation Strategy, on transport strategies. We provide commentary on rules and regulations that could actually see harm reduced, for example, rules around fossil fuels, for example, because what we want to see is that health in all policies approach. If we put that health lens over decision making, then there would be very different ways in which we would generate energy, think about transport. So that's a big part of the work that we do and that we involve members in. We listen to what members' perspectives are, experiences are, bring them to the table. We've very successfully over the years led delegations, engaged our members to go and talk to politicians and decision makers. And together we've had some really terrific outcomes, and we frankly have got climate and health on the agenda in our region. We also provide opportunities for additional services. So, for example, coming to speak to communities, we link members with their common interests to be able to accelerate their own journeys. And as I mentioned earlier, linking with resources and evidence base. So, we've now got a growing research community in climate and health in Australia. That wasn't the case 14 years ago. We have some terrific expertise, but we know we need to make that research ready for action, ready for policy. And so that translation piece that we work on is quite critical. We then, of course, also run the Global Green and Healthy Hospitals program, which is distinct from membership, but is something that is really important to convene that peer leadership, to convene the ideas, the communities of practice, to get action happening. And those actions on the ground are so critical to feed into the policy piece. So CAHA looks after both programs and supports members to be able to get action on the ground and the policy environment that will enable that action to happen.
It's amazing. And I think for anyone who's on the call, that is a great incentive to join as a member if you haven't already, whether as an individual and an organisation. And it ties into just another question that will this probably be, due to time, our last one, but that's been asked in the chat. And I think, Michelle, you've probably partially answered it here as well with Roger and Tony just earlier. But the question is, how are Bupa and CAHA bringing other organisations along on the journey who might need a bit of persuading about the benefits of being committed and taking action and investing their own resources in making changes for the benefit of the environment? I'm not sure who wants to answer that one. Anyone feeling adventurous?
Well, I think we bring health evidence and we're offering that, as a perspective. But we're also looking at the efficiency and efficacy of the way in which we, deliver care and helping other organisations to understand not only the impacts, but the health benefits of climate action. And so, we have our members cohort in their diversity, but we also work with a raft of other stakeholders and bring information in a way that we know will land and get traction with their boards and other decision makers. Health is a compelling argument because it affects all of us. It is an equity issue, but also there are huge health costs. And we all tend to know about the strains in the health system. What we want to communicate is some of the pathways, because if we have healthy communities, we also have healthy workers. We have healthy communities, healthy economies. It actually is an underpinning argument for every organisation, and we think we've got a message for each of them. But I'll let Roger jump in with some other insights.
Well, look, completely agree, Michelle. And I guess what I would add is I think there is more we can do in terms of buddying up and treading the halls of Canberra to advocate for change. I think if you think about a situation where you have a CAHA, where you have a Bupa, where you have representatives from the public health system and key stakeholders from across the CAHA membership, it's a pretty powerful coalition. And I think governments are and will increasingly listen to, coalitions of support which demonstrate there is strong clinical backing and expertise. There's a strong policy and evidence base. There's a strong kind of private and public sector kind of collaboration element to it. All of these mean that your advocacy, in my view, are likely to be more effective and more successful over time. And so I think there's huge opportunity for us in 2025. Obviously, it's a federal election year here in Australia, so there will be a lot of things thrown around, no doubt, on matters to do with climate change. And what we need to do is to ensure that the new government that comes in of whatever flavour has an open door for listening to evidence-based, clinically based expertise from organisations such as Bupa, from CAHA, and a number of other parties. I think if we can continue to mobilise that support, it's a very, very difficult coalition to say no to, and I think we've got real opportunities ahead of us to really ensure that health is central to this change agenda that we need to go on as a nation.
To just add to that, I was just at a Southeast Asian conference a couple of weeks ago, and a fellow from ADB was talking about, the health sector demonstrating what's possible. And I just want to pick up on the investment question. We have already seen some incredible examples here in Australia where health leaders, clinicians are leading on examples, particularly around value of care, and where they are demonstrating cost savings and advocating for reinvestment of those savings back into the work. So I think that's what we actually want to see across our sector as well. And by showing those examples and showing that health leadership, we're not only using our trusted voices, we're showing what's possible. And so I think together, cross-sector, in our diversity, we can amplify those really incredible examples. If health leaders under pressure and delivering such critical services can do this, then other parts of the economy and our community can also do the same.
That is the dream, and hopefully the reality as well. Well, thank you very, very much to our three panel members. That wraps up the panel section of this session. So thank you to Roger, Tony and Michelle for your time, for your insights. It's been really great to chat and to hear about all of the different ways that we can and are creating environmentally sustainable health systems. And what I'm really taking this, I think if I had to take one key takeaway, is that it's so important to work together across organisations and sectors to create meaningful change. It can't be done in silos, and it needs to be done with all members of the healthcare sector and actors outside of it as well, coming together and making that change. So thank you very much for joining. And we're going to jump in just a moment to our workshop component. So I'm going to give everyone a minute. I know some people need to leave. So I'll give 1 minute and we'll switch over into that part of the session. So thank you very much, and we'll resume in momentarily.